Hello my dear girls, I'm always excited to make a consistency video, and for today's lesson we will need a door and gloves. We will do some intraoral techniques. Today will be a lot about the depth that you're working on. So sometimes we will work superficial, then we will work muscular level, then we will work bone level. So pay attention the depths where you're going to with your fingers. And we will start from the door, and we will start under the gravity standing. And I want you to all to remind yourself where is your neutral pelvis position. Find the most prominent bone here and here. I even have a divot, and make sure that your pelvis is not like this. You see how the angle between these 2 points changes, and not like this, not a straight line or too posterior. Somewhere in the middle, that's your neutral. Make sure that your feet is under your hips and your knees are looking right on your second toe, and you stand like this in a neutral position next to the wall. You decide where you want to be. Maybe this is too much for the stretch for your pectoralis major. Maybe that's okay. However, we'll be lifting our hand while doing the massage. The first thing that we will do, very superficial, like you barely touching. If you feel in your hand, you're already on the nerves. So we will be doing this, and make sure that your pelvis is the same way as your feet. And your torso, of course, will be turned. But when you turn your torso, make sure that you rotate. You don't do something like this. When the waistline sizes, you see, it changes. That means the tilt. No, we rotate the shoulder, we are comfortable, and we are pressing with our little finger and the ring finger towards the door. So our attention is not here, we don't do this. We do actually this. We activating our serratus anterior and latissimus dorsi. Start tapping on the side of your body, and let's go. Very nicely you're going to be doing. Make sure that the pelvis is in a good position, and at the same time you will be lifting this side of the neck. So make sure that you don't do again something like this. You always lift from here into the diagonal. So this is how it's gonna look. And lift, like you're trying to reach with your ear up to the ceiling. And your hand is sliding with the whole attention towards your deep arm line. Very nicely. We just letting the body know. Lift your ears, stretch the side of your neck while sliding on the door. Good. Lift. And go straight to your shoulder. Now we will be standing and pressing. While you press, you're going to take your first knuckles, so a heavier tool, and do the same. And while you're going to be doing this, while you're going to be actually going into the muscle, you will be turning your head. So not doing the lift of the ear. Now it's a pure turn. Have your tongue on the upper palate. And turn. 3 actions. Pressing, activating, going with your knuckles, and turning, and having your tongue on the upper palate. Great. And drop your hand. See the opening that happened right here, and let's go into the trapezius. For the trapezius, we will just be doing the pinching technique. We will start from the furthest part and go 1, 2, 3, and you will lift your shoulder, you tilt your head towards the side that you're gonna pinch. You make sure that you're pinching, you comfortably uncomfortable, right? And then you're gonna lower your shoulder and tilt your head. The pinch almost will try to get out, but you need to pinch it for 5 seconds first. So let's go. and lower it. Another part. And lower it and make sure the trigger points are taken care of. Just do a little bit of intuitively massaging the trapezius from any point that can still have your arm like this. Then turn your hand medially, and you will see even more of your trapezius, and you're gonna continue massaging that. All of this, very strong fingers. All of this, and then you're gonna take a fold here, a fold like this on your trapezius, and go all the way down with that fold. Not the best t-shirt. Take a fold and roll the fold. Imagine the clothes that just went like this, and you undoing the clothes and you putting it towards the side. Relax for a second and feel if this has made the difference between two of your sides. We haven't finished with our chest muscles, but you should be feeling already the difference. Now we going into the sternocleidomastoid. I want you to start pinching the tendon. You can lift your hand, but this is preferably your shoulders leveled, and start pinching. It's never going to be meaty as a part of your bicep, but always a part of here, sternocleidomastoid. However, it's a lot of nerve and things are happening here. You need to make sure that the tissue is not super gummy. Okay, and here we're going on top of the sternocleidomastoid, and again, relaxing that part as well. All of this happening while our shoulders are down. Great. Now we're going to our second side. First we're sliding, doing the superficial massage, and then we are going with the knuckles, right? Make sure that you're standing somewhere where it's comfortable for you to make. Make sure that your pelvis is not here or it's not here. You are not here, okay? You are growing, you are the tallest that you possibly can be. You're getting comfortably so you don't feel that pinchy feeling or something like this that can happen. Make sure that you're standing with your pelvis, and let's start with superficial while lifting the ear towards the ceiling and breathing. If you feel tension going all the way up, you don't need to finish the range of motion. Now knuckles, and with the knuckles you pressing with this side of your hand. Get comfortable, make sure you're standing, and rotate your neck, having your tongue on the upper palate. Great. You might feel like one hand will be definitely more sore. For me, it's my right one. I'm right-handed. However, you can spend more time if one hand felt amazingly different from another. Yes, we all know pause and do it, because we still have that individuality in our bodies. Now we will go into the trapezius pinching. So you go like this. Drop, tilt. Pinch, pinch, pinch. Now the trapezius rolling. The rolling toward the back, very superficial. This one is superficial. We just went into the pinch, and now we just removing any tension from the first layer, basically layer of your fat and skin. Great. Now you do the medial of your, so inside of the hand, and checking if there is any other spots that your body tells you You need to press, you need to relax. When you press and it's like a spongy feeling. For the cells, you like press sponge so the dirt can come out. The same in here, the idea. Then sternocleidomastoid. Right here. Very good. For the second set of exercise, we will need a sofa, something that you can put and hold your forearm. Maybe it's a chair. However, make sure that your pelvis is higher than your knees. I had to put a pillow under mine, and make sure that these two sides of from your rib cage to your pelvis are same. So you're not sitting somewhere here, right? You see how this is long and this is short, or somewhere here, whereas your lumbars are super short and here overstretched. So make sure that you find that neutral that is comfortable for you now. We are never going to be perfect, but we have to start looking for that axle in between us, where we're the longest, where we're the evenest, and how does it feel in our body for now. However, put your hand here so we relax the forearm, and we're going into our pectoralis minor. Our pectoralis minor is the one that does this, and super short in a lot of you pictures, and it's a lot of professionals don't address pectoralis minor. They think they can just address it like this, but that's not true. You need to go underneath, you need to go into your armpit, and you need to follow your rib cage. So everybody tapped and understood that here's ribs and the rib cage and the pectoralis major, and sitting like this on top. So you need to follow the rib cage and go not in here, but in here. You might not be touching your muscle, but at least you will be touching the fascia. We will go with the very relaxed fingers. We will be just sliding. I'll show you how we're gonna do it. Make sure that you don't have a nervy feeling, because you might, because we are addressing area where there's a lot of nerves. If you feel, just move 1 centimeter away, and that's it. You're not gonna have it. But make sure that you're not just coming, like I know it all. No. Discover your body. You probably never went into your armpit yourself, but we all have a lot of lymph nodes. We have again the postural muscle lives there. It's still you. We will be going into the ear today, so make sure that you understand it's your own body and you can enter it for sure. So but ask permission from it. So firstly, very nicely massaging, and I'm just seeing where's my rib cage, I relaxed my hand, and now I feel like, okay, I'm getting there. I'm gonna bring my shoulder higher, and it's gonna help me to get even more. This is my goal. My goal is in here. My goal is I'm not just driving to my shoulder joint. No, I'm going this way. I'm going to my heart. I'm going to my heart. And lifting my shoulder will let me understand that, and then I'm gonna drop my shoulder. And when I'm gonna drop my shoulder, I'm gonna start pressing again with that side of your hand down, bringing your scapula down. But when this is happening, make sure something like this doesn't happen, right? It's just your shoulder. You're gonna start pressing, and maybe or maybe not, you will feel there is something contracts nearby. You maybe need to change the position of your fingers. You maybe need to understand where's a new opening. But even the massage of the fascia out there, it's already so therapeutic and so helpful. And just let's continue doing that. And just think about the ribs, think about going inside, think about pressing slightly, not like you for your life pressing your couch. No, you just give it, oh, I feel my muscle contract. Okay, great. And lowering the shoulder and telling your nervous system that's okay. We can be here. We can be here. We don't need to be here always in this stressed response. And you massaging. Some people might be, half crying right now, but we don't need that. Slowly but surely you will feel comfortable massaging there. But for now, just be cautious and careful. And just take a second. I think I even see how my just like this now. Feels like this at least. Now you're going into our other part. You're going inside of your arm and try to press your hand towards you. You will try to press her hand towards you, and you will feel like, oh, it's muscle pop out somewhere here. Besides muscle, there is also strings. We don't want the strings. We want that meaty, that little sausage. Sausage, yeah, it feels like sausage here. And so make sure that it's sausage. Press on it. Okay, it's sausage. It's not giving you like a sparkly feeling in your fingers. No, so it's sausage. So now you lift your shoulders. Your hands stick to the sausage and to the tissue that around the sausage. I'm sorry if somebody cannot stand that word. And now you lift your shoulder and then you drop in your shoulder and your hand super deep and slow, lowering it like this. And you can stop somewhere here. And take a second. We do a lot today, but arms does influence the neck influence the face. Hello, right? We all know that by now. Now you're going into this part of your, so this is your sternocleidomastoid and this is your trapezius, right? And something is leaving here, super important. And what I want you to do, again, relax this hand, lift this hand, and understand where we're going. We're going right here. Again, could be nervy, be cautious, be curious, but it's totally normal to touch it, and we need to relax it, and that's one of the postural muscles for the neck, for a lot of things that are happening with the neck. So we're gonna lift. I'm gonna slightly, nicely, I'm very nice with my fingers. Sometimes I'm rough and bossy. Now I'm not bossy. Now I'm like a kid that got lost, and got somewhere where he wasn't or not supposed to. But it's okay. They welcome him. They love touch. Everything loves touch. So very nicely, you let your hand up, then you let your hand down. Your fingers are slowly will be like falling off the stairs, very nicely. Don't push it. And now you tilt your head super slowly. With your idea, your ear goes up, this shoulder is not stressing, just like this. And relax. See the difference, feel the difference, and we need to do the same for the second side. Sitting correctly, make sure that all is correct. And now start slowly understanding where is your ribs and slowly going. Just again, curious. You can remove this big muscle, not remove it, but lift it up. Don't remove your pectoralis major. So you're just going, you're following the ribs, fingers are relaxed, like a brush. And now you're gonna start slowly lifting your shoulder, understanding that, oh, I actually can go deeper, and slowly lower your shoulder and press, nicely press, just activation with the side of your arm. Good. A little more. Breathe. And give it a little love. Now find this part. Press your hand towards you so you know they are there. Lift your hand. Make sure that you glued with your arm to your lower arm and just let it drop. Great. Find your window and start first massaging it. Just remove any tension that you might feel and understand where we're going. Now go like this. When you lifting your shoulder and letting understand that there is a spot to go, and then you're gonna lower your shoulder. Your fingers got a little bit deeper. You can take a breath and you will feel like those muscles engaging if you take a deep breath. And then tilt your head. Tilt your head. Fingers are not pressing, the gravity is already doing it. You pinching and stretching. Great. Front of the neck technique. we are not doing if we know for sure we have something going on with thyroid. Just miss this technique. The rest, find your hyoid bone right here. And by the way, we have in our tongue on the upper palate. You smile, open your mouth. Do this suction feeling. Again, wide smile. Upper palate, this is where the tongue will live, especially important for everything what we're going to be doing today with the tongue and with a neck. So find the hyoid bone and find the lower part. So we work as diagonals. We work as a spiral technique. The lower hand elbow goes up and two hands feel each other. So I'm not stretching like, going into the periosteum. But if I'm even a superficial, if the hands on the same level, they will feel each other. If one hand is deep and another one is too superficial, they won't feel each other if they move. You will know that hands are same level. So elbow up, tongue up, hyoid bone, you just a little bit. Now you do pre-stretch, very slight. And then you lower your elbow slowly, increasing the stretch and rotation. As you can see, my hands are not moving around and they barely touch on second side. Find the elbow that the lower hand is up. Make sure that your hands feel each other. And lower the elbow. Lower the elbow. Lower the elbow. Fingers stuck into the tissue. Lower the elbow. Great. Now they're under the chin. Under the chin, we will go right under the bone and we will do spot by spot. We are massaging this bone, the points where our muscle connects. So you go under and massage spot by spot, spot by spot. Chick, 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 chick. This is the upper palate where I want you to have your tongue. Not soft palate, but upper palate, as some people have a narrowing of the upper palate. The whole tongue doesn't fit, but slowly but surely, you need the support for this maxilla bone. As you can see, it makes your eyes, it makes your cheeks. And if this goes smaller and low, like inside, you have a lot of extra tissue that will have to fold as nasolabial folds or as other not nice things in here, right? So let's go with massaging spot by spot. Closer to the masseter, middle thoracoid right here, but don't go inside, go just, you massaging the bone, you're trying to get to the, under the jawbone. And go back. Shoulders down. Here 2 fingers can be, and here you can apply a little even more pressure, because here you're not gonna go under the bone. Here's super strong muscles here. And let's, with these 2 fingers, move a little bit the chin at the same time, down. And now let's go, I was doing this motion, like down, down. Now I'm gonna go another side. You can do this, anything that feels like your tissue wants to go and doesn't want to go. This is 2 spots where the tissue will have a change. Great. Now this part by part. And going back. Great. Now slide like this and go down. Just anything that we just open, maybe was too extreme, we're just gonna drain right there. Light touch. The drains are clearly open today, all of them. So we will take this opportunity and drain it right now. Now I want you to touch your upper trapezius. So right here, this is the skin, but if I tilt my head, I can grab a little bit of trapezius. And what I want you to do is tilt your head, go like this with the chin up so you can grab it, and then slowly growing from here. So not just dropping your face down. So growing from here, you're gonna get this and stretch. And again, get this. Stretch, lowering your head nicely. And you almost should already get into your, closer to your spine. And under your skull, right here, place your hand, one here on this meaty occipital part right here, and tilt your head, and another hand placing this right here, somewhere where your facial artery goes. Very, very light touch, and again, feel like, does the hands seems to be on the same level, because we want the same level. And if you stretch, like if you go like this, does your hands feel each other? You can't talk like me, because you have to listen. Yeah, okay. Tilt your head, now grow with your head, and this hand slightly lifting to the, lifting 3 centimeters. And relax. Just a relaxation. Even if you feel like you don't feel anything, trust me, you're doing this. Now we will be doing pressure of the tissue like this towards your C7. C7, you know, all of you, if you drop your head, this is a prominent bone that goes here. Some people have lymphatic there stuck, so I want you to address, but I feel like you never see it from the back, so I want you to show you from the front. I'll go right next to, here's my spinal column, I go right next to, and I'm gonna hold it, and I'm gonna lift my chest, not my ribs, my chest. My ribs are down. My chest, I'm gonna be lifting it, I'm gonna be opening it, I'm gonna be pinching my C7 and lifting like somebody is lifting, opening all of sizes in the front of my chest, including the side. And I'm gonna do it with the breath, and I'm gonna really be bossy. I'm gonna be bossy around my C7. But I want you to see the motion from the chest. If you don't do the chest, the massage C7 will take you a bit time, but we want to do the structure massage. So you pinched it, you make sure that you pinched all of this tissue, all of this meaty lymphatic part. And now you pinched it and you start stirring it, shredding it, very, very strong, right? And lifting your chest. And breathing and shredding. Girls, again, everybody is individual. Some people have a lot of things to do there. Do it every day. Do it every day. Make sure that you do the rest, but do this every day. After the shower, before the shower. You can do it up to 3-4 minutes. You're watching a movie, you're waiting somewhere. You just don't forget this together with all of this. Now going back to the second side, and again, find your side of the trapezius that gets gummed up because of our position, but doesn't get stretched out, and start stretching. Tilt your head and then grow with your head. Grow, tilt and grow. Tilt and grow. Find your occipital bone, understand where we're gonna work, find that, make sure that your hands talking to each other. Okay, tilt your head, lift your head and stretch from the back of the neck side. Great, just double check with your hands that all your neck feels soft. a little more drainage. Now I want you to go into your temporalis bone. Your temporalis bone, temporal bone, sorry, temporalis, it's a muscle. So this is occipital and this is the bone, like this, right? I want you to take it like this. I want you to take it like this. I want you to imagine that here's your ear and you take in these two bones like this. So they are not taking the whole space, but they are like this. And I want you to do a little vibration, like this on them. And while you're doing this, we're going to blink. If you know that you had epilepsy things and you cannot blink too often, no. Just do a little vibration into the bone. My hands are not running around, they're here, and I blink. Now I'm gonna be blinking and looking at one side of the ear. And then another one. Then I'm gonna go up and do a whole circle. 2 circles while blinking. 3 circles. Now another side. Your eyes might feel already a little bit tired. It's okay. And relax. Relax, and now take your hand, place it like, listen to your bone, and that might sound crazy. And ask your bone to move a little bit towards this side and diagonal. Like you're trying to move it that way. You will be like, okay, that's it, Anastasia. No. We have here a process that connects to our jaw muscles. So with time, the position of the bone, because of the masseter and tight temporalis is changing, and we need to make sure that the bone stands on the correct space. So you place your hands, and honestly, it's all individual in a sense of like you place your hands and you feel like you do a little traction, 10 gram traction, and you see which way does the bone want to go this way or does it want to go that way? And if it doesn't want to go the one way, you go opposite. It's indirect technique. You go opposite. You wait 5 seconds, and then you go to the direction that it didn't want to go. If you feel like you don't understand, you don't know, like, what is she doing? She's not even moving her hands. It's okay. This is osteopathy. They work on a bone level, and we need to get out of that idea that, you know, as much as I address this fascia and meat, we also that human energy can be in that can regulate that. But I'm hoping that everybody here is already advanced. So you might feel it. You might not happen on the first week of you doing this, second week, third week. This, great. Now you find this bone, and we will open the tissue on this bone. So we place 2 fingers and just slide, open, just slide, open, slide, open, slide, open, slide, near the eyebrow, and you finish. Open, slide, open, slide, open. Great. Now we are going into our ear, then we will wash our hands and continue with the face massage. So with the ear, what I want you to do, one hand is diagonally pulling it out and up, right? Like this. This is, I'm exaggerating just for you to understand what I'm doing. This hand, it goes, yes, right down, to the ear channel, inner channel, and pulling the tissue out. So it's like you pulling something and you want to get it out. You're not going to be able to pull it, but this is great for the brain and for drainages. So lower this 2, 3. So 1, 2, 3, 4, right? Another one, I'm going in and I'm pulling the tissue, and I'm going as deeper as I can, and I'm pulling this tissue. I go up, I go deeper as I can, I control my shoulder not to do this, right? And I'm open. Oh, you might feel a lot. You might feel a lot of freedom in your brain. Yeah, right now we are working with a Duramer. Okay, so go in and open it. Go in, open it, go in, open it, go in, open it. Oh, wonderful. Wash your hands and we start with the face. While you put in your gloves, I'm going to explain you what we're going to do with our massager. So we're going to go into our mouse all the way, then you're going to meet the bone. You're not interested in the bone, you're interested in the massager. You're going to pull this massager, you're going to open, close your mouse to understand when you can take this part, right? You'll not be able to grab to this one. And you're going to pull it this way. Then you're going to go second floor and you're going to pull it this way. And the third floor, couple times each floor. So it's gonna look like this. I'm not interested in the bone. I'm going higher and pulling it. Super tough. You're not gonna be able to pull it, but a little bit relaxation you will achieve. Great. Now you're taking your finger, you're going into the nose and you're moving the tissue away from the nose hole. So right here, right on the corner of your nose, you're moving the tissue one spot. 10 times. Now you're going to enter your finger, you're going to turn it the way that nails is touching the gum, and you're going to lower your head and open the seam in between your face and your bone. So you're going like this, you're turning and you're opening, going all the way. Lower your head, don't press with your finger. Don't press with your finger, just lower the head and the pressure of the head will do that. Now you're going inside and again turn the nail side towards your gums. And lower your finger, close your mouth. And go all the way. Same on the second side. Together with the massager, I need the glove. Go on the bone. Of course, you're not going to be able to take the massager and bring it to your nose. No, but get the tension away from the bone. Yes. Now the nose part. 10 times. Now I'm going to change my finger. Turn your finger and go with the pressure of your head. You will feel like it's like a crazy feeling, like a butter that melting. And you might not, you might be somewhere here, you might be very deep. But slowly but surely, you're gonna open face. One more time, lower. Oh, this one was definitely interesting. I'm gonna go one more time. Now the depressor, pull it out and go up. Pull it out and like drive it up. But first you need to pull it out, not this, like pleasant. No. Now it's a little unpleasant. Pull it out, out, smile, and bring it to your malleolus. Slow. Let's do it again. Smile. Malleolus, corner of the leaf, massage like it's a ball. Feeling like a ball, you're not gonna be able to massage it out like it's gonna feel like the same tissue, but removing the tension, a lot of muscles are connected there. Great. You see? Second side. Of course, it's gonna go down. I'm gonna talk and I'm gonna do faces, but slow. Smile. Smile when you know you got him. Then when you smile. Now corner of the lip. Now, your tongue. I want you to grab it from one side, from the root, as far as possible. Looking at me, having your tongue pull out towards the camera, you're gonna turn, rotate your head like this. So that's how it's gonna look. Huh? Huh? Second side. So you, eh? Huh? Amazing. Now take your two fingers, two big thumbs, and massage your upper palate. Right here and right here. All of this, like this. And then drop your head and just stay like this for a second. For a minute. Breathe. Breathe, not pressing with your fingers, just letting your head rest on your fingers. Then take your tongue and we will be just pulling this out and forward without moving, just making sure that we are in a good gravity position. And have your head, elongate your head. If you need to do this for this, okay, but elongate your head. Make sure that your head is on top of your body and you elongating while you're pulling your tongue out. Chest up. Wonderful, wonderful. Now, what we're gonna do now? We are taking this finger and going right on top of the nose, right here, and massaging there. Have your hand stabilize and massage with your finger, like you're trying to massage your nose from the inside. Oh, hello. Good. And we're gonna do the same on the inside. Great. Great. Remove the gloves. We're going now the technique for the tongue. So your upper palate, you're gonna, with your tongue, with the tip of your tongue, you're gonna start drawing. You can draw your name, you can draw your last name, it can be big, it can be large. I want the motion. Like this. You need to feel activation under the jaw muscle. You can make letters small. Now, 2 fingers here, tongue pressing into the 2 fingers, fingers pressing into the tongue. Make sure that something like this is not happening. You see how my jaw shifted, not my tongue? So instead, so make sure, take your hand, jaw wants to help. No. Second side. Great. Great. Now we will just be pulling the tongue out while we take the tissue from here like this, just like this, and like this, crisscross. You have your hands on your clavicles. Make sure that this is not happening. When I ask people, I'm like, no. Yes, your jaw can be slightly open and shifted, but not like, and not the head. I'm more worried for the head. And now we're going to be slightly lifting our head, not fast, no. And make sure that this is happening on the same axle that you found, not, no. Shoulders down. One more. The same, but the sides. So when you, again, have your tissue up, when you do this side, you just emphasize this side of the stretch. This hand is just telling, both hands telling the shoulders, you're not helping, you're staying low. Make sure that the jaw doesn't help that much. Second side. Like a lizard, like a lizard. Okay, let's go with a little bit of the eyes and the scalp. So you're going to be doing the hairline pinch and massage. Pinch and massage. Pinch and massage. Make sure that you don't do something like this. Like this is already not the line. You understand? It's like already not the correct roll. The roll is much smaller. And massage. Up. You see, this is not correct roll, so I have to take the tissue from here and say hello. I want a nice forehead, and I know you wanna get to my scalp. Hop. Hop. Shoulders down. Can't even pinch here. My hair not too tight. This is just scalp. Right now we're wearing a lot of hats, right? We're trying to protect our face from the sun, but our scalp gets a bit, so make sure that if you're wearing hats, they're not super tight and that you address your scalp afterwards. I'm gonna come back to the areas where I was like, whoa, 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 and I'm gonna check there too a little bit further, you know, because we want that roll and shift. So if you feel like, oh, there are areas that I cannot pinch, go back to them. And make sure that, of course, with a little love, you can pinch up. And great, great. Now place your hand like this under your eyebrow and lower your head. Lower your head and imagine you're not touching your eyeballs, you are massaging the bone that's on top. Make sure that you don't touch eyeballs. You just very lightly, it's a super light vibration that probably not even seen on camera, but I'm on below my eyebrows, just a little vibration. I'm sliding this down, and here with a little larger motion of vibration, my eyesight is not disturbed because I didn't touch my eyeballs. I am here and a little vibration. So this bone, and again, better higher, but nothing touching your eyeball. A little vibration, and then you go in with a little vibration into your temporal ralis fascia and massaging it that way with a little vibration. Today will be vibration day for the face, which is very good. Now you put 2 fingers like this, so strong fingers, 3 actually, under here, under your eye, or here under your cheekbone, and vibrate again very lightly. I'm exaggerating, the vibration is very light, starting from your elbows, basically. Vibrate your hand, so it's not your fingers that like doing this to the tissue, it's a light vibration, light. You have to feel like your bones are there, but it's a light vibration, almost a good reflex if you're gonna start like feeling like, oh, you itch somewhere, like it feels like itchy. That's the one we want. Now you're going to place 2 hands like this, and we're gonna vibrate very lightly. We are not going too deep. We are vibrating with 2 fingers and going up. This is not super deep. This is vibrate on your center of your brain, not brain, bone. Great. After you did this vibration, we open the eyes. We're going on top of our zygomatic arch and hold the tissue here. So this prominent bone, there is a hole here and here. So chick, and this is the prominent bone. Show you. Right, this one. You're interested in this. One stands here We were vibrating, by the way, somewhere here, so we were not vibrating on that spot. And this one, this stands here firmly, you lower your head, and this is vibrates up. This is vibrates up. The same here. Now, another part, we taken a little fold, not when we do this massage, no. This is for the super SMAS. This is for your superficial fascia and subcutaneous fat. You take the fold not like this, you're not pinching. This is would be the skin, too small. A little higher than the skin, and you nicely, slowly rolling this like this, small, up towards your nose. One more time. Feel what gets into the tissue. Does the tissue feels similar from one side, or one feels firmer, another one feels empty? This is what we reorganizing right now. The same second side. We open the space from the inside, now we can reorganize the skin. Now with lips, we're gonna do this motion. Remember this motion, the forehead will get the same one today. Lower like circles, spirals. You know what's on my hair? I'm sorry. Every time I make a video, at the end of the video, I'm face looking better, but the wrist looks a little I work. So smile, and now you see the line of the diagonal, the same thing. You're taking very, not this, no. Up, the first layer, not super skin, but the first layer, and you're going to take that smile into this fold. This is the level of the layer I'm trying to show you. And take it like this, like a mask. Yes, like a little tougher than a face mask. If you ever done that, like the sheet with double E, the sheet lay mask. Like imagine you put 3 masks. Have you ever done the gel one? The ones that like the gel for the whole face? There's a little bit more than that. But we organizing the fascia. You will love the result, but these techniques are really good for people who has a lot of fat on the face, and for people who doesn't have a lot of face, it's also good, but it has to be done like once per week. For people who has a lot of fat, we have some more powerful techniques to kind of balance it, but this technique is more safe. So if you feel like you are in that category of a big face, you can do this one more 2 times. I cannot, because I work with my face so much, I cannot do superficial techniques too often. Just a little bit, yes. Now you're gonna start pinching this lateral muscle on the side of your lateral nose. And when you're gonna know, okay, I pinched it, you're gonna open and say, oh, but slowly, otherwise it's gonna fall off. Oh, 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 like you're trying to lower your upper lip. Oh, and pinched. Good. Now you take 2 fingers and just a little vibration here, just a little bit on top of this bone, just a little bit, light. And we're gonna go on the lateral side and open. So you open in this part. Open. Nice. Not super deep. Not super deep. You open in the tissue. not super deep, just here. Then tap here. I'm pretty sure your eyes already looking amazing, amazing. Now 2 fingers and 1 finger, this is a deep technique. 1 finger is the one that on top is going very deeply on top of your corrugator, okay? So like this, and this finger is deep, deep, deep going through the bottom of this eyebrow. And then they change. Deep. Deep and parallel, deep and parallel, deep and parallel. Drop your hands on your eyebrows, under your eyebrows, and just massage with like this motion your eye muscle. And when you're gonna drop me, go like you're trying to stand here on this bone with the fingers. So, but if you feel like you're touching your eyeball, look down, but very light, like a cat paw. Great. Now, let's just lift it like this, just if we dropped it. And with your 2 fingers, start doing these motions of spiral up to your hairline. We're gonna relax our frontalis today like this, and bring some blood flow and calm down. Everything is ready. Your face should look amazing. However, after any intraoral technique, sometimes the result, the actual lifting, happening next day, just so that you know. So see, if you're not happy with today, tomorrow you will be happy. And of course, we finishing with the scalp massage. The scalp massage today will be a little different. We will take the hands and open the tissue. So you take your hand, and like your fingers already belong to your scalp, and they open. They make this, what's the name of it, lock, and then they open, and that's a great relaxation. Here on the bigger part you might need 2 locks, but you know that your tissue, you touch it and you open it. And this is again very important for the summertime, and just addressing the scalp as much as you can. And relax. If you feel like, okay, there are like some lock opening, so like you take your hands and you go inside of your hair. Here I'm already up, and you move in the tissue, and if great. And girls, we are done. Great, great, great job. I hope you will love this lesson as much as I do.